As pet parents, we want to provide for the wants and needs of our dogs while also ensuring their happiness and health. Unfortunately, there are occasions when it can be difficult to understand exactly what your dog is trying to tell you due to the language barrier issue. Knowing what your dog needs to remain healthy and secure is your responsibility as a dog parent. Your dog may be struggling and in need of assistance if he suddenly starts acting differently. So here are 10 signs that your dog is in need of your help. You may notice something is wrong if your dog has lost his appetite, becomes suddenly hungry, or is consuming much more or much less water than normal. These indications may be subtle. You might see your dog leaving a bowl of food or water unattended, losing interest at mealtime, or searching the house for new sources of food and liquid. If a dog is in pain in a bodily part or one of their legs, they will most likely exhibit some form of lameness, which is the inability to move one or more limbs. Or they may cry when touched in the area that is hurting. Scratching or licking the region is also a very common sign, as well as vomiting, diarrhea, discharge, respiratory problems, or coughing. To examine this sign, you will have to really watch your dog and their behavior because a dog will have a lot to do with this cause. Anxiety, which can be brought on by a number of factors such as being apart from you, loud noises such as those made by storms, fireworks, or cars, or having to adjust to new people or pets in your home. The greatest method for calming your dog will be clear once you identify the cause. When your house-trained dog has an accident, he's not being bad, he just needs assistance. Just like babies, dogs tend to become accustomed to a schedule. They typically have some wake up and bedtime every day, as well as regular eating and bathroom schedules. So when your dog starts going to the bathroom inside instead of going outside the home, there may be a problem. Another sign is having to go outside more or less than normal. Even though dealing with accidents at home might be difficult, anger and punishment won't help the situation and might even make it worse. This behavior is nearly always a call for help, so make an appointment with your veterinarian for a diagnosis and any required treatments if the change persists for more than 24 hours and more frequent walks are ineffective. Your dog's activity level may vary suddenly and unusually, which could indicate a problem. Your dog may unexpectedly experience prolonged energy spikes or experience lower than normal energy levels for a variety of reasons. If the behavior persists for more than 24 hours, you should take your dog to the vet for a diagnosis. Lethargy is a common sign of sickness in young, active canines. It might just be a bad day or something they ate, but you should get advice from a specialist to be sure. Constantly licking their paws and scratching are two signs that your dog may be dealing with some concerning issue. It might be connected to a dog's allergies. Signs can include red or inflamed skin, stinky ears, brown staining near the feet, and in rare cases, sneezing, diarrhea, or vomiting. Since it could be a number of reasons, it causes discomfort to your pet and needs to be treated. Untreated allergies can lead to bacterial or fungal infections. Although your dog may tear up the couch or destroy your clothes or shoes due to separation anxiety, this behavior is occasionally the result of boredom or lack of toys, especially when young. What is the quickest approach to stop this behavior? Well, ensure your dog receives enough daily, mental, and physical stimulation. So spend more time walking, playing, and connecting with your dog. If your dog is still destroying things after that, seek advice from your veterinarian. If your typically friendly dog starts to remove themselves or shows no interest in cuddles or toys, there might be a problem. Your dog may be acting in this way for a variety of reasons, but one of the most frequent ones is that he is in discomfort or sick. However, in certain instances, the issue may be as straightforward as your dog is not getting enough activity or food. Determining the likely reason for their abrupt lack of attachment could be a variety of reasons. So again, visit the veterinarian if the behavior continues after 24 hours. A dog who is coughing, experiencing runny nose, or having trouble breathing may have a respiratory infection, pneumonia, or chronic obstructive pulmonary disease, also known as COPD. The quick onset of respiratory difficulty may indicate that they consumed or inhaled something that set off that reaction, so it's advised that you take your dog to the vet as soon as any of these symptoms emerge. Dogs typically respond in the same way to repeated circumstances. The same dog that is typically friendly might suddenly start hiding when people come over to the house, or start growling or barking in a hostile manner, which could indicate anxiety or aggression. For instance, dogs that are typically sociable, playful, and greet new people in a friendly manner will most likely always behave in the same way around strangers if they're used to new people coming to the house and playing with them. So if you notice changes in their behavior, something deeper could be going on. Sometimes it may be challenging to recognize sudden or odd changes in behavior. These changes could be brought on by trauma or disease, stress, or cognitive disorders like canine dementia, which affects older dogs. So if you notice any behavioral alterations in your dog, you know best. It's advised to visit a veterinarian for more information.